Introduction. Legal and ethical principles of consent. Informed consent is a legal and ethical principle that requires healthcare providers to obtain a patient's voluntary and informed agreement to undergo a medical intervention or treatment. This involves providing patients with the information they need to make informed decisions about their healthcare. Importance of informed consent in healthcare. Informed consent is essential for respecting patient autonomy and promoting high-quality care. Key elements of a valid informed consent. The key elements of a valid informed consent include disclosure of the nature and purpose of the intervention or treatment, risks and benefits, alternatives, and consequences of not undergoing the intervention or treatment. Legal and ethical principles of consent. Explanation of the legal and ethical principles of consent. Informed consent is a legal and ethical principle that requires healthcare providers to obtain a patient's voluntary and informed agreement to undergo a medical intervention or treatment. This involves providing patients with the information they need to make informed decisions about their healthcare. Importance of informed consent in healthcare. Informed consent is essential for respecting patient autonomy and promoting high-quality care. Key elements of a valid informed consent. The key elements of a valid informed consent include disclosure of the nature and purpose of the intervention or treatment, risks and benefits, alternatives, and consequences of not undergoing the intervention or treatment. Types of consent. Explanation of the different types of consent. There are 4 main types of consent: express, implied, verbal, and written. Express consent is given verbally or in writing, whereas implied consent is assumed based on the patient's behavior or actions. Verbal consent is given through spoken words, while written consent is provided through a signed document. Examples of situations where each type of consent may be appropriate. For example, verbal consent may be appropriate for routine procedures such as blood pressure checks, while written consent may be required for more invasive procedures such as surgery. Consent process. Overview of the consent process, including discussion of risks, benefits, and alternatives. The consent process involves providing patients with information about the risks, benefits, and alternatives of the intervention or treatment. This discussion should be tailored to the patient's individual needs and preferences. Explanation of how to assess patient capacity to make decisions. Healthcare providers should assess a patient's capacity to make decisions, which involves determining whether the patient has the ability to understand the information provided and to make an informed decision. Guidelines for obtaining valid consent. To obtain valid consent, healthcare providers should ensure that the patient has received all the information they need, that they have understood it, and that they have had sufficient time to consider their options before making a decision. Shared Decision Making, SDM. Explanation of the concept of SDM. Shared decision making is a collaborative process between patients and healthcare providers, where they work together to make decisions about the patient's healthcare based on the patient's values and preferences. Benefits of SDM for patients and healthcare providers. SDM has been shown to improve patient satisfaction, increase adherence to treatment, and improve patient outcomes. It also reduces the risk of litigation and improves job satisfaction for healthcare providers. Role of healthcare providers in facilitating SDM. Healthcare providers play a crucial role in facilitating SDM by providing patients with information about their healthcare options, eliciting their values and preferences, and incorporating these into the decision-making process. SDM steps. Description of the steps involved in SDM. The steps involved in SDM include identifying the decision to be made, providing information about the options, eliciting the patient's values and preferences, discussing the pros and cons of each option, and making a decision together. Barriers to SDM. Discussion of common barriers to SDM. Some common barriers to SDM include time constraints, lack of training and resources, language and cultural barriers, and power imbalances between patients and healthcare providers. Importance of addressing these barriers. It is important to address these barriers in order to promote patient-centered care and improve patient outcomes. Strategies for effective communication. Effective communication is key to promoting SDM. Strategies for effective communication include using plain language, avoiding medical jargon, using open-ended questions, active listening, and acknowledging the patient's emotions and concerns. Active listening involves focusing on the patient's words, avoiding interruptions, clarifying understanding, and demonstrating empathy. This can help build trust and improve the patient-provider relationship. Culturally responsive communication. Culturally responsive communication involves being aware of and responsive to the patient's cultural background and beliefs. This can help build trust, improve patient satisfaction, and promote better health outcomes. Examples of cultural differences in communication. Some cultures may value directness and assertiveness, while others may value politeness and indirect communication. Understanding and respecting these cultural differences can help facilitate effective communication. Supporting patients with decision-making. Strategies for supporting patients with decision-making include providing them with unbiased information about their options, using decision aids, and involving their family and support network in the decision-making process. Importance of addressing the patient's emotions and concerns. It is also important to address the patient's emotions and concerns, as these can impact their decision-making process. Benefits of SDM for patients. SDM has been shown to improve patient satisfaction, increase adherence to treatment, and improve patient outcomes. It also promotes patient autonomy and respect for their values and preferences. Examples of how SDM can improve patient outcomes. For example, in shared decision-making about cancer treatment options, patients who participated in SDM reported less decisional conflict and fewer regrets about their treatment decision. Benefits of SDM for healthcare providers. SDM can also benefit healthcare providers by reducing the risk of litigation, improving job satisfaction, and promoting better patient outcomes. Examples of how SDM can benefit healthcare providers. For example, healthcare providers who use SDM reported feeling more confident in their ability to communicate with patients and in their ability to provide patient-centered care. Challenges and limitations of SDM. While SDM has many benefits, it is not without its challenges and limitations. Some of these include time constraints, lack of resources, and power imbalances between patients and healthcare providers. Importance of addressing these challenges. It is important to address these challenges in order to promote patient-centered care and improve patient outcomes. Conclusion and call to action. Summary of the key points covered in the presentation. Today, we discussed the legal and ethical principles of consent, types of consent, the consent process, shared decision-making, benefits of shared decision-making, barriers to shared decision-making, and strategies for promoting effective communication and shared decision-making with patients. Call to action for healthcare professionals. As healthcare professionals, it is our responsibility to promote patient-centered care by facilitating shared decision-making with our patients. By using these strategies and addressing the challenges and limitations of SDM, we can improve patient outcomes and you may refer to above for further reading. Let's start with MCQs. What is the legal and ethical principle that requires healthcare professionals to obtain informed consent from patients before providing treatment? A. Autonomy. B. Beneficence. C. Non-maleficence. D. Justice. Answer. A. Autonomy. What is the term used to describe a patient's voluntary agreement to undergo medical treatment? A. Informed consent. B. Coercive consent. C. Implied consent. D. Expressed consent. Answer. A. Informed consent. What type of consent is given when a patient gives permission for medical treatment after receiving information about the risks and benefits of the treatment? A. Implied consent. B. Expressed consent. C. Informed consent. D. Coercive consent. Answer. C. Informed consent. What is shared decision making? A. A process where the healthcare provider makes decisions for the patient. B. A process where the patient makes decisions for the healthcare provider. C. A collaborative process where the patient and healthcare provider make decisions together. D. A process where the patient has no input in the decision-making process. Answer. C. A collaborative process where the patient and healthcare provider make decisions together. What are the benefits of shared decision-making for patients? A. Improved patient satisfaction. B. Increased adherence to treatment. C. Improved patient outcomes. D. All of the above. Answer. D. All of the above. What is the term used to describe the power imbalance between patients and healthcare providers that can be a barrier to shared decision-making? A. Autonomy. B. Beneficence. C. Non-maleficence. D. Paternalism. Answer. D. Paternalism. What are some strategies for effective communication with patients? A. Using medical jargon. B. Avoiding open-ended questions. C. Using plain language. D. Interrupting the patient. Answer. C. Using plain language. What is active listening? A. Focusing on the patient's words and demonstrating empathy. B. Interrupting the patient to provide information. C. Using medical jargon to communicate with the patient. D. None of the above. Answer. A. Focusing on the patient's words and demonstrating empathy. What is culturally responsive communication? A. Being aware of and responsive to the patient's cultural background and beliefs. B. Ignoring the patient's cultural background and beliefs. C. Using medical jargon to communicate with the patient. D. None of the above. Answer. A. Being aware of and responsive to the patient's cultural background and beliefs. What are some strategies for supporting patients with decision-making? A. Providing them with unbiased information about their options. B. Involving their family and support network in the decision-making process. C. Using decision aids. D. All of the above. Answer. D. All of the above. What is a limitation of shared decision-making? A. It requires too much time. B. It can be difficult to implement in practice. C. It can lead to patient dissatisfaction. D. None of the above. Answer. B. It can be difficult to implement in practice. What are the benefits of shared decision-making for healthcare providers? A. Reduced risk of litigation. B. Improved job satisfaction. C. Promoting better patient outcomes. D. All of the above. Answer. D. All of the above. Thank you for time and attention. Contact information for further discussion or questions.